Welcome, welcome. You're tuned into Have More Babies. Today we're going to explore a topic that, well, maybe isn't talked about every day, but is super important for parents and really anyone interested in kids' health. We have some really great material here from Omega Pediatrics, and it really unpacks a skin condition called Guttate Psoriasis. When we think about common skin stuff in kids, usually it's like eczema or maybe acne that comes to mind first, right?
Yeah.
But today we want to shine a light on guttate psoriasis. What is it? What kicks it off? And crucially, how do you manage it? We're here to help you get informed quickly and clearly. Okay, let's get into it. So jumping right in, guttate psoriasis, it sounds kind of serious, maybe a bit intimidating. Can you help us understand what it is exactly? And maybe for parents listening, how is it different from something like eczema? What does it actually look like on the skin?
Yeah, absolutely. It's interesting because you're right. Eczema and acne get most of the attention, but guttate psoriasis is it's definitely its own thing in pediatric dermatology. It's a specific type of psoriasis, and what you see are these sudden outbreaks of small kind of dewdrop-shaped bumps. They're usually salmon pink.
Dewdrop shaped.
Yeah, that dewdrop visual is
That's
pretty
it.
key, and it's different from, say, plaque psoriasis, which involves those thicker, scaly patches most people picture. Guttate lesions are typically smaller, thinner, and they often appear quite widespread, on the main body, arms, legs. And it's an immune thing. It's not just skin deep. It's reflecting something happening inside the child's immune system.
Salmon pink bumps, like dewdrops. That's a really helpful picture. So if a child suddenly gets this, what sets it off? What are the usual triggers parents should maybe look out for? This is where it gets really interesting, I think.
It really does. And this brings up a critical point about, how the body reacts and maybe even prevention. The Omega Pediatric source material really highlights that for kids, guttate psoriasis very often follows an infection.
An infection, like what kind?
The big one is strep throat. That's a bacterial infection. And what's really crucial here, what parents need to know, is that it's often a post-strep reaction.
Post-strep, meaning after the throat infection.
Exactly. The skin flare-up might happen, say, a week, maybe 2 weeks after the strep infection occurred, sometimes even after it's been treated.
Wow.
Yeah, so it underscores why getting strep diagnosed and treated quickly is important, not just for the throat, but maybe to lessen the chance of this kind of reaction later. And it's not just bacteria like strep. Various viruses can also be triggers.
Okay.
Think about common kid stuff like chickenpox, maybe tonsillitis, even just a bad cold or the flu. These infections can sort of prime the immune system, leading to this skin response.
Right.
And then there's stress. The source mentions this too. It might seem surprising.
Stress in kids triggering skin stuff.
Yeah, significant emotional stress or upheaval. For some children, it seems to act as a catalyst. We're talking about how stress hormones can actually influence immune function. It's complex. And one more thing, even a small injury to the skin, like a scrape or a cut, maybe even bad sunburn, dermatologists call it the Koebner phenomenon.
Keebner. Okay.
Yeah, sometimes that injury site can trigger an outbreak in kids who are prone to it. It just shows how it's often this systemic immune thing going on.
It is fascinating. So it's the body's reaction, sometimes delayed, to infections, stress, or even injury. Knowing that, it's clearly more than just how it looks. You mentioned discomfort, itching, staling. What's the full picture of symptoms? And maybe more importantly, how does this actually impact a child's life beyond just their skin?
Yeah, connecting it to the child's overall well-being is key. Those pink bumps are the sign, sure, but the physical experience can really vary. Itching is very common, and it can range, from just mildly annoying to really intense, really disruptive.
I can imagine that being tough, especially for a little kid.
Definitely. It can mess with sleep, make them irritable. And the spots themselves might have thin scales that peel off. Plus just general discomfort, maybe a feeling of soreness, especially if there are lots of spots or they're in sensitive areas.
Mm-hmm.
But you absolutely hit on a crucial point about the impact beyond the physical. Having a visible skin condition, especially when you're young, can really affect a child emotionally. We're talking potential hits to their self-esteem, their body image, how they interact with others.
Right. Kids can be sensitive about looking different.
Exactly. They might become self-conscious, maybe avoid swimming or sports or situations where their skin is visible. And that can lead to feeling anxious or frustrated, maybe even withdrawing a bit socially. So for parents, giving that strong emotional support, talking openly, maybe educating the child and even their friends about it.
Yeah.
That's just as vital as any cream or medicine.
Yeah.
It's about helping them feel okay in their own skin, literally and figuratively.
That makes so much sense. Addressing the emotional side is just huge. So, okay, let's say a parent thinks, My child had strep a couple weeks ago. Now they have these spots. They suspect it might be guttate psoriasis. What happens next? How does a doctor figure it out for sure? What's that diagnosis process like?
Well, the good news is the diagnosis is usually pretty straightforward.
Yeah,
That can be a relief for worried parents. Often, just a good look at the skin by an experienced pediatrician or maybe dermatologist is enough.
just by looking.
Yeah, the way the spots look, that dewdrop shape where they are on the body, combined with that history maybe of a recent infection like strep, those are strong clues.
Okay.
Now, if strep is suspected as the trigger, they'll likely do a throat swab, a culture, just to confirm the bacteria, even if the sore throat is gone.
Yeah.
It helps pin down the cause.
Right. Connects the dots.
Exactly. In rare situations, maybe if it doesn't look quite typical or they need to rule something else out, a skin biopsy might be done. That's taking a tiny skin sample to look at under a microscope. But honestly, that's not usually needed for most guttate cases.
Got it. So usually visual exam, maybe a throat culture.
Yeah.
Okay, so once it's diagnosed, what's the plan? What are the treatments? Is there a cure, or is it more about managing it day to day?
That's the key question. The source material is clear. Currently, there isn't a single cure that makes it go away forever. But, and this is a big, but there are very effective treatments to manage the symptoms and really improve the child's quality of life.
Okay, that's good to hear. What kind of treatments?
It's usually tailored, depending on how severe it is, where the spots are, the child's age. Often the first step is topical treatments, creams you put right on the skin.
Like steroid creams?
Yes, corticosteroid creams are common. They work really well to reduce the inflammation, calm down that immune response in the skin. There are also non-steroidal options like calcineurin inhibitors.
Calcium, what was that?
Calcineurin inhibitors. They're interesting because they target specific immune cells in the skin without being steroids. So they can be good for sensitive areas like the face or for longer-term use.
Oh, okay. Good to have options.
Definitely. And if it's more widespread or maybe not responding well enough to creams, light therapy can be really effective.
Light therapy, like sitting under a special lamp.
Sort of, yeah.
Yeah.
Uses specific wavelengths of ultraviolet B light, usually narrowband UVB.
Mhm.
It's done in a controlled way in a doctor's office typically. And that light helps slow down how fast the skin cells are growing and reduces inflammation. It's pretty effective for many kids.
Huh. Interesting.
And then for really severe cases, or ones that just aren't getting better with topicals or light, there are systemic medications. These are pills or sometimes injections that work throughout the body to help regulate the immune system more broadly. But the goal always is symptom control, reducing the itching, clearing the spots, minimizing discomfort, and just letting the child get back to being a kid.
That's really encouraging. Lots of tools in the toolbox then. And you mentioned earlier, is there sort of a silver lining? What's the long-term picture usually like for kids with this? Does it stick around forever?
This is genuinely the good news part and really important for parents to hear. For many, many children with guttate psoriasis, it actually resolves on its own as they get older.
Really? It can just go away?
Yeah, a significant number either see it become much less frequent and severe, or they completely outgrow it. Their skin clears and they don't have more outbreaks.
Wow, that's fantastic news.
It is. Now, some might have recurrences, maybe if they get another strep infection later on, but often it's milder. And effectively managing those triggers we talked about, that seems to play a big role in that positive outlook. It really reinforces that understanding the condition, being proactive, it makes a real difference for the child's future health. It empowers families.
Absolutely, but that's incredibly hopeful. Okay, so let's recap for everyone listening. What does this all mean for you? We've learned guttate psoriasis shows up as these unique salmon pink kind of dewdrop bumps. It's often kicked off by infections, especially strep throat, but also viruses, stress, even skin injuries. It really highlights that connection between overall health and skin health. We talked about the symptoms, not just the look, but the itching, the scaling, and importantly, the emotional side for kids. And while there isn't a magic cure right now, it is absolutely manageable. There are effective treatments, creams, light therapy, sometimes medication. And the really encouraging part, many kids see significant improvement and quite a few actually outgrow it completely over time. Now, if you want more detailed information, trustworthy medical advice, great resources on kids' health, including guttate psoriasis, we strongly recommend visiting omegapediatrics.com. They really are a fantastic source for expert guidance, just a wealth of information there for parents and caregivers. That's omegapediatrics.com. And hey, if you found this discussion helpful today, if you learned something useful, please do give us a like and consider subscribing to Have More Babies for more talks like this on children's health topics. And maybe share this with another parent or caregiver you know who might find it valuable. Your support really helps us keep these conversations going.
Yeah. Thank you for tuning in and exploring this with us. Remember, knowledge really is power when it comes to your family's health.
Absolutely. Until next time, keep learning, stay curious, and always seek out the information that empowers you and your family. Goodbye for now.